After 23 years in the military and an additional 12 years working on the research side, I am thankful for the opportunities that the military has provided for me to be able to move forward. Without all of the advanced, or access to the advanced research that is going on, it would have been very difficult to accomplish many of the things that we have done. And for that reason, I stand before you here to update you on some of the things that are happening within the military research community as opposed to the clinical ones. The people before me have done a superb job on showing you some of the things that are beginning to actually be used today. I will show you things that are not being used today, but may be and will significantly perhaps change the future of the way not only battlefield medicine is done, but also the way the entire practice of surgery moves forward. Can I just get a show of hands? How many saw the lecture that was given yesterday by myself? 1, 2, okay, great. So for most of you, this much of the things that I will show you, not all, but much of the things will be a repeat of what I showed yesterday, because I believe that this indicates a new direction over the next 50 years that we will be seeing in medicine in general, and particularly in surgery. I think we're in the middle of a truly profound revolution. This is not a small revolution anymore, but it's a profound one. These are some of the disclosures that I have. One of them that's relevant to this somewhat peripherally is I have a grant from Intuitive Surgical, but it's to develop the fundamentals of robotic surgery training system. I must parenthetically say that the presentation by Commander Nelson was extraordinary. I've seen the cut suit. If you haven't seen it, I have no relationship to it. Matter of fact, it was not even one of my programs that I developed. That is a truly remarkable system, extraordinary. And for those of you who do trauma or could even imagine working on trauma, polytrauma as we see it today, this is an experience that is above and beyond anything that we've got available today. It's orders of magnitude better than anything that we've had before. This is about changing things. And in the news the other day, on the 8th of April, the Navy made a remarkable announcement. They have just deployed for the first time a true laser weapon system, taking out drones simply by pressing a button and destroying them in the sky. Why is this important? Well, this is 20 to 30 years of research by the military under classified conditions, refining systems to such a point that their accuracy and the precision is so incredible that they can actually do what we've imagined for 50 to 100 years. It is now real. And the reason that this is relevant to us is the technology that allows that on a large scale can be done, and most of the infrastructure for it is available to us in the military healthcare system, or the healthcare system in general, should we choose to embrace this new concept. And I'll try to show you what I interpret as the concept that the military is moving forward, and that will redefine not only weapon systems for the next 50 years or more, but also the direction that we need to go. The other component about this is that if we look at our non-medical colleagues, all of their investment, or the majority of their investment in the past 30 to 40 years, has been not at the macro level, but has been at the micro and the molecular level. By that I mean huge investments have been made in things such as brain imaging, molecular biology, genetics, proteomics, metabolics. All of these recent major discoveries in the non-surgical component have been down at the molecular level. And we are still in the 5th century BC, or the Renaissance, where man was the measure of everything, meaning that no matter what we would do, particularly in surgery, is to today, is done at the macro scale, centimeters and so forth. So I will bring these concepts to you. So this is part of what the information age is, and I'd like to redefine what the information age is as we move forward. It is an age of enhanced human performance through new technologies. The electromagnetic spectrum, or energy, is something that we, particularly as surgeons, have rarely, if ever, addressed. Once again, as I mentioned, That is why I think that demonstration by the Navy was so huge. It marks a change from kinetic and mechanical systems to energy-based and information systems for the military. We're going to see more and more of that. We need to follow their lead. We need to be pioneers, if you will. My view is if we, as surgeons, don't accept the concept that information and energy are changing the way all of healthcare is done, like many other fields, the medical people will pick up on this. They will take the things that surgeons normally would do, and they would adapt them to themselves, and they will become medical procedures. The electromagnetic spectrum is huge, and we use a very, very tiny component of it. So the future is that this is the electromagnetic spectrum, all the way from gamma and X-rays, which are very short, to the long waves, such as radio waves and so forth. We are using a tiny component of that, maybe 3 to 5% of the available energy that we could exploit to improve patient care is actually being used. It's all about exploiting energy and information, not just one, but the combination of the two. These are intangibles. I really can't touch, feel. I can measure energy, but I can't touch and feel it. But on the other hand, neither can I touch and feel information. But we use, at least at this point in time, a lot of information, and we've been ignoring the opportunities of using energy. Why is this possible, and what is the revolution infrastructure that supports this? Well, it's about interacting, if you will, at a completely different conceptual level. Today, we act at the level of meters and centimeters. In the future, we will be acting at microns and nanometers. We do things in seconds, and if we're really, really fast, we've got systems that do milliseconds. Things today are starting at microseconds and femtoseconds, billionths of a second. And from watts and kilowatts, huge monstrous machines, as you miniaturize the devices that you're doing, as you do things quicker and in shorter time frames, you can reduce the size, and instead of having massive energy requirements in large systems, you can have small handheld portable instruments because they only require milliwatts and microwatts. These systems control molecules and electrons. They don't control livers and kidneys and spleens. And as we well know, that is what our livers, kidneys, and spleens are made from. They are made from cells and molecules and electrons. So the question is, can we exploit this area? Well, I think so. The military calls their new innovations in weapon systems directed energy weapon systems. So I have coined the term directed energy surgery. And we're seeing some energy, for example, some of our electrocoagulators we've had for quite a while, our various acoustic types of coagulators and so forth are just beginning to emerge. So we are actually looking at some of them. The accuracy of them gives us microns to nanometer accuracy, which we've never had before, particularly if you couple it with the robotic system. And as I mentioned, the sizes are smaller, the amount of power that we use is much, much less. Literally 9-watt batteries are more than adequate to provide energy for the system. And the reaction time now is really, really tiny, and we've got massive computers that can do the computation that's required. The reaction time is interesting. If we look at how fast the systems react, look at this from an inverse perspective. For example, our hands can sense at 1 kilohertz, 1,000 hertz. Many of the systems that we have, and I'll show you a couple that are experimental now, the average time in order to perform something is 50 milliseconds. If you look this from the inverse component of that, which is in 1 second, this device does 50 complete actions. I'll show you what those actions are. I don't know of any human that can do any any activity 50 times in 1 second. Most of my actions take at least a few seconds to complete. But the systems that we have built to enhance human performance work at this level. Hundreds of actions occur every single second if you use these devices. So it's all about combining information and energy and building intelligent systems. For example, the way this is, from a conceptual to an example system, is that when you input energy of some kind, whether it be light or ultrasound or microwave or whatever, this energy perturbs whatever tissue you're putting on it. It changes it. When you shine light in it, some of it is absorbed and some of it is reflected back, and that allows us to extract from that the information about what the tissue is. We've seen this over and over again, Raman spectroscopy, hyperspectral analysis, and so on and so forth. Putting in energy and receiving a signal back tells you what that tissue is, i.e. automatic diagnosis. And how fast is this done? When you use ultrasound, we're talking in the high kilohertz and the megahertz. Thousands of times per second it measures the tissue and tells you what you're looking at. The same is for lasers and other areas of photonics, measuring tens of thousands of times per second the tissue and providing that information to you. And then what you can do is with this information, you can control that same energy, but at a different bandwidth, if you will. So we have a number of systems I'm going to show you in a moment that allows you to go ahead and diagnose the tissue in less than 50 milliseconds and turn on or turn off the instrument that you're using for therapy in that same modality. So the fundamental the change that we have from industrial age to information age is going from tangible things that you can touch and feel to intangible things that you can control, such as information and energy. And as we said before, it's no longer about blood and guts, but it's about bits and bytes. This is the direction that we're going to be moving in the future. Here is one of our prototypes that we've been able to complete. This happens to be using ultrasound, and once again, we have closed-loop control. A similar one here is in the area of a laser scalpel. This is by Physical Optics, a company down in Los Angeles. We already have the prototype. I am not allowed to show that at this time, but what this allows you to do is have two lasers that focus 5 millimeters apart. The first laser that looks 5 millimeters ahead is the diagnostic laser, and the second is the therapeutic laser, but it's at a different wavelength and a different power source. It's a cutting laser. And so what we've been able to do is first characterize tissues so that the diagnostic laser knows the difference between arteries, muscles, fat, and so on and so forth. And it also uses the same bandwidth that we use for our pulse oximeter. So it's not a revolutionary, it's just an application of a technology that we're familiar with. It looks at the tissue and it looks for underneath the tissue if there's any blood vessels. And as it goes along, it cuts. And when the diagnostic laser sees a blood vessel, as manifest by our pulse oximeter LED, it turns off the cutting laser. And you can keep on cutting. It will instantly turn off, and then as soon as you pass the blood vessel, it will turn it on again and continue the cutting, allowing you to go ahead and cut through tissue, avoid vessels that you would not want to cut, but what you are not able to see with your own eyes. This is just one example. Next generation is looking at identifying, for example, cancerous tissue. We can put into the laser system the signature of the cancer that you're looking for. And then you can just use the system, and it will automatically only cut and ablate the cancer tissue and will turn off within 50 milliseconds before we can even move a millimeter. We'll turn it off so it doesn't cut any of a normal tissue. So this is one example of the direction that we're going. And the ability of the robots to be able to position things so precisely, the robotic system that you use today, the Da Vinci, has the capability built into it automatically of 10 micron accuracy. I personally measured that accuracy in the prototype which was shown by Miran Anvari. So we've got the capabilities, and coupling systems like robotic systems with our energy-based systems will be able to move in a generation well beyond anything we had before. Robots are changing. This, if you haven't seen, is called Petman. This is the next generation of robot the military is building. It is not controlled by anyone. It is given instructions, and it can navigate environments. It is able to perform activities that have been what we call subsumptive architecture, which means you give it an instruction such as squat and turn, And it will do that entire system by itself automatically with its sensor being able to adapt to the environment, whatever the environment happens to be in it. The ability to pre-program by mission instead of pre-program by action is the next generation of robots that we're going to see. And of course, when they're bad, they have to do their push-ups, as we well know. So once again, we're looking at intelligent systems being able to be built into the robotic systems that we're being able to perform. This is the example, once again, of combining energy with diagnosis. That's high-intensity focused ultrasound on a lens of a calf, and when the yellow light went on, it coagulated the tissue. Notice it did not injure any tissue in between the center and the periphery. This also is another attribute of the new generation. It is going to be non-invasive at a level of accuracy that we don't have today in non-invasive systems, if you will. There will be no incisions in the future. We truly will operate through image guidance and energy direction into the internal portions of the body without ever making incision. It is no longer fantasy, it is real. We are beginning to do this today. MRI guided and CT guided, and in the next generation, terahertz guided are going to be systems that are going to be spectacular. Getting back to the ultrasound, here's the Doppler ultrasound on a pig, internal iliac artery model. Laceration of that model results in death in 15 minutes. That's the model for exsanguinating non-compressible hemorrhage. However, with HIFU and Doppler together, you can diagnose exactly where the bleeding is and press the button, and instantly it will stop the bleeding. When you turn the Doppler back on, there is no more bleeding. Does that sound familiar? Somebody's injured, the battlefield, out on the highway, they're exsanguinating from internal hemorrhage. You come up with your instrument, you do your Doppler ultrasound, you find out where it is, and press the button, and that individual is cured. No surgery required, end of story. Star Trek, anyone? No, it's not. It's a thing that's been proven in the laboratory repeatedly, and things that are beginning to move out into other areas of investigation. Another area, and we saw a lot of problems, and may reflect back to the interesting presentation that we had about the abdominal wall reconstruction. Contamination is one of the biggest problems that we have here. This is plasma medicine. Plasma is the fourth state of energy. It's the energy that, of matter, rather. It's energy that you see at the end of lightning. You see this great big flash, and then there's this kind of a glow afterwards. That glow is energy in many different forms. We have learned how to control that now. It's called cold plasma, and now we're beginning to apply that in the medical field. This is what's in that cloud after you release the energy. And we have charged particles and free electrons. We have reactive species, reactive nitrogen species, reactive oxygen species. We have ultraviolet light, visible light, high temperature if we choose to go up on the power, electromagnetic pulses, and the pressure pulse wave. All of these forms of energy are at the molecular level. We are learning how to control these, which means we can turn on and turn off individual molecules at our own selection. So what are some of the biological effects that we've known? And this research is 4 years old. It's no longer classified, all right? We can turn on and turn off specific molecules. We have proven we accelerate coagulation at least twofold. By directly activating prothrombin, we can increase wound healing by activating angiogenesis and VEGF. We're beginning to learn the mechanism of action, if you will, of the energy that we now have learned that we can control down at the cellular and the molecular level. But even more important, we've known that we can use plasma for sterilization, but we haven't paid much attention to it because the systems were huge. Now that we've got small handheld portable systems providing cold plasma, what we have discovered that the sterilization capabilities are exactly the same at the lower level as they were before. And what's unique about them? There is no known biological agent that is resistant to plasma. Can I repeat that? No known biological agent that is resistant to plasma. Why is that important? There will no longer be anything called antibiotic-resistant bacteria, virus, even spores. And recently they've discovered we can kill prions. There is nothing that we are aware of that can resist plasma, except living human eukaryocytes. Why? It turns out, we believe, because this is so new, that the reason that human cells aren't killed by plasma, but everything else is that human cells have their DNA protected by a nuclear membrane and have in them activations that are able to deactivate the effects of some of the plasma. And so all the experiments to date on wound, and I don't have time to go into all this stuff, have demonstrated that we can kill literally any known living biological agent without injuring human tissue. And we can do it in 30 to 45 seconds using a handheld portable instrument. So next generation is going to be huge. And so I think that we're going to be looking at different ways that we can exploit this. One of the drawbacks of it is, at this point in time that we're aware of, plasma is a surface phenomenon. We cannot get deep into tissues. It doesn't extend below approximately a ½ millimeter. But we can do this for surface phenomenon, and I think that for things like the abdominal wall reconstruction we saw earlier, this can be a real boom, plus all of the other wounds that we have on the battlefield. And imagine also if you're out on the battlefield and you have a significant wound like we have seen, you can not only sterilize these wounds, but you can begin accelerating the wound healing process immediately. There are many, many other things, discoveries that are happening with plasma medicine. I'm very enthusiastic about the next generation that we're going to be seeing from that. So my view, 50 years from now, the majority of what we're going to see is going to be directed energy surgery if we grasp the opportunity at this point in time. If we don't, someone else will be doing directed energy procedures, not surgeons. This is going to be the next generation. And why do I know that? Because I put on a number of conferences with science fiction writers, and they've been writing about this for 50 years or more. And the time has finally come when their view and their vision of what the future should be, we now have the technology to make that happen. So femtosecond lasers, this is another technology that's going to allow us to manipulate things at the molecular and cellular level by pulsing. So each pulse is 1 × 10⁻15 seconds, or a billionth of a second. We can actually make incisions in cells, reach inside, and use things like optical tweezers and terahertz graspers, and allow us to manipulate individual organelles within the cell. At the University of Dundee in Scotland, they are actually operating on individual chromosomes, removing bad genetic sequences and replacing them with good ones. So you as a surgeon in the future may become a genetic surgeon, operating on individual cells and changing their genetic makeup. And in order to do that, we're going to have to learn how to use our instruments. Because, for example, when you are working at the cellular and the molecular level and you apply your energy, you can't see the structural change. But by having the systems we've got available, what ends up happening is the things that you direct your energy at will change their reflection of their light. And so they'll be changing colors. So we'll have to look at a different way and learn a different way of understanding how the effects of our surgery are progressing. And this is just an example of one of those projects in which we've got multiple different ones that are showing the changes as we go by. I mentioned about the use of light. Biophotonics is huge. At the meeting, Photonics West in San Francisco this past February, there were 2,000 papers on the biological effects of light, how we can use not only lasers but other parts of the visible and near-infrared and ultraviolet spectrum to manipulate biological tissues and human tissues. This is an example, for example, in the food industry, in which they have taken hyperspectral analysis to the udders of a cow, and they have coupled it to the robotic milking system that's been available for decades. And as the cow moves in, they scan the bladder, and they find out where the position of the individual teats are. They feed that information into the robotic system, which automatically goes up and couples on them. They monitor it while it's being milked, and as soon as the milk is gone and no longer there. It automatically decouples it, and the next cow comes in place. So we have systems that are smart enough to be able to detect through the skin what's going on and then apply some action with it. This is one of my more favorite ones for inspections, automatic inspections. This happens to be with chickens. You're able, with this system, which is standard now in the chicken industry and the larger corporations, to bring the stripped chickens on a conveyor belt, and they are rotating at 2.5 rotations per second. And what happens is every time the chicken goes by, it rotates in front of the laser scanner. The laser scanner, through hyperspectral analysis, identifies whether or not any of the 100 known pathogens are on that chicken and is able to, with 2.5 rotations in 1 single second, diagnose whether or not there are any pathogens on there and then pass it on as a non-contaminated system. Today, without the system, it takes you about 25 to 30 seconds to do an inspection and to be able to take a swab, and 2 days for the reports to come back. But they're doing these at 1 chicken per second being able to go through there. Once again, emphasizing the fact that the systems are available today and they perform actions well beyond anything that any single human can do, giving us in real time where we can use the information and move forward. And this is probably one of the most revolutionary things that have come out of DARPA recently. This was a program back in the early 1990s called Stereo-lithography, based upon standard inkjet printers that we had in our computers. And imagine, if you will, printing a page like with a CT scan, and each time you come to a different scan, you add another level. But instead of using ink, you use metal or plastic or some other form of material. And what that allows you to do is to build up a 3D image. Stereo-lithography allows you to actually build physical objects from information if you've got the materials available for you. Tony Atala has taken this to the next generation with his regenerative medicine program. He is printing livers, kidneys, and spleens with individuals' own stem cells. And when he transplants them, without any chemo or immunotherapy, they no longer need to have that chemotherapy, immunotherapy. They are able to accept the transplants from their own stem cells and not require any further therapy. The beauty of that, in my mind, is going to be that my question is, are we going to need transplant surgeons anymore? The reason being is that their main function is to manage the rejection phenomenon. But if there is no rejection, it's your own stem cells, are we going to need a transplant surgeon? Can't, for example, a urologist take out a kidney and put in a new one just as well if there's no rejection? Can't a general surgeon take out a pancreas or a piece of bowel if there's no rejection? So I think we have an opportunity here in the not-too-distant future to reorganize the way that we're doing, to grow artificial organs or to print artificial organs, and to be able to change, in essence, the direction that we see in surgery. Now, I like upper GI surgery, particularly gastric surgery, and I know 23 different operations for the stomach, depending upon what the problem is. My question to you is, what does the future look like? No matter what gastric operation you have, we'll be able to print you a brand new stomach that will not be rejected and replace your stomach instead of doing all these complicated operations. Think about this. Have you ever taken your automobile in and they fixed it? Nobody fixes anything anymore in any other industry. They find the broken part, they take it out and give you a brand new part. We're still trying to fix broken parts instead of replacing them. This is the future, I think, that we're going to be looking at for surgery in terms of how we approach a number of diseases. But more important, getting back to stereolithography, why I think it's so important, is I think it's even more important the internet, because the internet allowed us to use information and share it and do communication and collaboration. What this is going to be able to do is allow us to go to the internet, find what we want as a CAD/CAM drawing, as a computer model of what we would like, personalize it for ourselves, download it to our own home, where we would have this $2,500 MakerBot system and actually print out what we want. We are doing this with a very, very small selected number of areas, such as children's toys, shoes. Today you can go to Adidas or Nike and you can download, if you had a MakerBot, you could download the shoes that you would like that would be for your own fit, and you can print them in the MakerBot that would be sitting on your desk. This is what is able to be done today. First generation, very crude. We're like at the TRS-80 or the Altair of computers back in the 1970s. But it's not going to take long, I believe, for this to catch on now that we've got a system that's usable and that's at commercial grade. All 3D printers up until this time cost tens and hundreds of thousands of dollars. Now you can get that same capability at about $2,500. So these are the kind of technologies that we see moving forward. Micro-robots are going forward, but we're also looking at using microtechnology to control living systems. That Sphinx moth that you see, I actually took the controller and I was able to fly that moth around the laboratory at the University of Washington. We are looking at printing electronic circuits on our skin or the next generation inside of our skin. Actually printing a sensor right into your skin to be able to monitor your health. Intelligent prostheses, they are now coupling the next generation of upper arm prostheses with the brain-machine interface control programs, if you will. And the recent discoveries on the medical side about the function of the brain is being coupled with technologies that will allow us to be able to monitor individual thoughts and be able to interpret those thoughts and be able to create actions with them, if you will. I think this is a profound video. What we see here is a mouse. In its brain, it has optical electrodes, and it's sending signals in, signals of light, because they're so fast and so precise, well beyond anything that we have in electrical systems. And here is a mouse, and they have interpreted what part of the brain and what the pattern of the signal for turning left is. Normally, they would have a mouse that would be random. And so they implanted in the brain of this mouse here one of these electrodes. And every time they turn on the light, you can see the little blue dot, every time they turn on the light, the mouse turns left. And as soon as they turn it off, it walks around at random, it turns it back on, and it makes it turn left. It knows what that individual thought is that controls the left-hand turn. And you may have seen, see if I can get to the next one, Miguel Nicolaus at Duke University took it one step further. He was able to take what they call the encoder rat and do the same thing that I just showed you, understand what that signal is. And then every time they stimulated that mouse, its thought was sent to the next mouse, and that mouse would turn left. Every time that the encoder rat would turn left, the decoder rat would also turn left. We were sending the thoughts from one mouse to the next mouse. And every time one mouse did something, the decoded one would have to do the same thing. We may be replacing telephones and your iPhones with some form of thought decoder that will be sending your thoughts from one to the other. Science fiction, for 50 to 100 years, we are beginning to make progress in there. Extraordinary complexity is beyond the capabilities of doing this in humans today, but we have the science that will enable it coming out of the laboratories for military research. So I want to thank you for the opportunity to present these new concepts and ideas and welcome any questions you may have. Thank you.